Hi, everyone. We're going to give people just one more minute. As soon as I see the numbers stop continuing to go up, we'll go ahead and do our introductions. Okay, we are, I think, still have some additional people joining us. And so I just want to welcome everyone to our spring uh, Title 4E Child Welfare Dialogue. Many of you have been coming to these for years. I'm Ellen Smith, and I'm here today. I'm the Associate Director of the School of Social Work, and also I also oversee our child welfare training program. Sorry, can't remember who I am or what I'm doing today. Alice normally would be here to do these introductions, but she got called away, and so I agreed to step in for her. And I'm very, very pleased to be here today and to introduce our speaker. We are going to be having the pleasure of having an hour and a half with Dr. Tiffany Lindsey. Her pronouns are she and her, and she's an assistant professor and a safe systems practitioner at the Center for Innovation in Population Health at the University of Kentucky. Her work focuses on quality improvement and system reform efforts in child welfare jurisdictions. Lindsey has specific expertise in applying safety science to improve the safety, reliability, and effectiveness of organizations. Her approach leverages tools like organizational assessment, team-based behavioral strategies, and systemic analysis of critical incidents, which include deaths and near deaths, to help organizations learn and improve. She has over 10 years of experience in child welfare and is the co-author of 2 tools within the Transformational Collaborative Outcomes Management, or the TCOM framework, the Safe Systems Improvement Tool, the SSIT, and Team First, a field guide for safe, reliable, and effective child welfare teams. With the support of Casey Family Programs, Lindsey has provided technical assistance and content expertise to the National Partnership for Child Safety, the first member-owned quality improvement collaborative in public child welfare. Before coming to the center, Lindsey served as a quality improvement director within Tennessee's Department of Children's Services, DCS. During her time at DCS, she oversaw the department's nationally acclaimed child death review process and was foundational to its creation. She provided leadership to DCS's safety culture survey, confidential safety reporting, and several other applications in safety science. She taught team-based casework strategies at DCS's Child Protective Services Academy, held in partnership with Vanderbilt University and the Tennessee Bureau of Investigation. Lindsey also has a strong clinical background working with vulnerable populations. She's a licensed professional counselor with a special designation as a mental health service provider. She holds a Master of Arts in Marriage and Family Therapy Professional Counseling from Johnson University and a Doctor of Education in Leadership and Professional Practice from Tribeca Nazarene University. And when she's not working, you'll probably find her playing with her children, who hopefully will make a short appearance this afternoon. Her 3-year-old and 1-year-old. She likes ballroom dancing with her husband and enjoying local farm markets. And we so wish that you could be here to one of the best farmers markets in the country, which starts soon, but it's still winter here. Dr. Lindsey, we are so pleased to have you with us today and to share all of your experiences on this really important topic. I'm going to turn it over to you, and you can tell the group that how we're going to handle questions and things. So let's give a warm welcome to Dr. Tiffany Lindsey.
Thank you so much. That was a long introduction. I forgot that I'd put all of that in my bio. Perhaps the only important thing to know about me is that I used to be a case manager myself and do work, and all my work has been in the public child welfare space, either as a case manager or a supervisor or as a program director. And now my work is in service and advocacy of those agencies. So I'm honored to be with you. And jealous to hear of your farmer's market. Now I need to plan a trip to Wisconsin. All right, well, I'm going to go ahead and share my screen. I think I probably have about an hour, maybe a little more than an hour of content here for us to walk through. And please use the question feature in this Zoom webinar. So if you have some questions, put them out there. We'll probably save, unless there's like a real pressing emergent question, we'll probably save them until the end, just to see if I got there. Maybe my slides are already headed in the direction of your question, but maybe not. And we'll have some chance for conversation at the end. Go ahead and share my screen. All right, Ellen and Cynthia, I'm looking at you all. Are you able to see my screen and you see it in presentation mode and not in notes?
Yep, you're good.
All right, perfect. All right, so I just wanted to start by saying, where do I dedicate my time? What's the work that I do every day that draws me to you today? And it's really the National Partnership for Child Safety. It was in Ellen's very kind introduction. The National Partnership for Child Safety is 27 public child welfare agencies across the country, including Wisconsin, including DCF. You were actually one of the pioneering, one of the first members to join the National Partnership. And they have an express mission to improve child safety and to prevent harm to children, explicitly child maltreatment fatalities, but other harm as well. By strengthening families, promoting innovations in child protection, central to this work is thinking about safety science to inform a safety culture. And then also, how do we draw upon those really important sciences around improvement and implementation? The partnership is the first ever, that I know of anyway, the first ever member-owned quality improvement collaborative in child welfare. I think that the pioneering group of jurisdictions who formed the partnership knew that if they wanted to create these safe, supported spaces for professionals as you serve families, and if they want to hear your candid experiences about what you need from your systems, if we want to move big systems to change and transform in the way that we serve families in the future, then you need a community, like not only external accountability, but that really important connectedness across jurisdictions, across agencies in the country, all leaning into this way of thinking, to these values and strategies that I'm going to talk about today. It is my great honor to get to serve the partnership, and especially just to get to learn from the partnership. I feel like I get to sit at the feet of some of the most incredible change makers in our field. And I tell you what, those change makers started out as case managers, as supervisors. They started out on the ground serving families, and they never forgot how much, or how difficult, how hard, how high risk, also how impacting that work with families was and is today. So this is what the partnership looks like today. A really good mix of state agencies, county agencies. We also have a tribal nation, all in the partnership. And West Virginia just joined this week. They're not on the map yet, but I need to add them. So here's what we're going to talk about today. I want to talk about a really specific type of organizational culture, one that I think bears really significant impact to caseworker and family outcomes. And I can prove that through a little early evidence, but I also think that you're going to find this pretty intuitive. But hopefully through this conversation, I'll build some intentionality, some shared language, and maybe I'll give you some ideas of how it might impact your work as a supervisor, or your work as a caseworker, and the way that you engage with families and with your colleagues. So safety science to inform a safety culture. What do we mean, right? What do we mean when we say that? It's uniquely an organizational culture that acknowledges the high-risk nature of your work and the determination to always find ways to do it better. You come into families' lives at some of the most critical and difficult times of their lives, the most critical and high stress, high risk moments that they've experienced. Those are the moments that you're stepping into. If you're not first responders, I certainly don't know who is. You're stepping into some of the most difficult moments in families' lives and making choices that impact the rest of their lives. So it's acknowledging just how risky and important that work really is, and our determination to always have a growth mindset. It's importantly this promotion of a blameless environment where, as professionals, we can report the things that worry us, we can report the things that didn't go the way that we intended, we can report our mistakes without fear of reprimand or punishment. So crucial to a safety culture is this blameless environment where we each feel like we can bring ourselves, what we are strong at, and what we are challenged by to work every day. It's encouraging collaboration across ranks and disciplines, so no single one of us holds the solutions to these really complex challenges that we face in our work with families. Multi-layered, many systems, many agencies. It's knowing that no single one of us has the answer, but we have to be really intentional to think how we collaborate, to think about how we can innovate. And then it's committing resources to what you learn, right? So it's not that we're all talk and no action, but it's that we're talk and we are also action in committing resources to safety concerns. How do we advance the safety culture? Well, we do it first by pursuing a new lens. We cannot think of people as being the imperfect agents in these perfect structures that are our systems. That is the design, right, of child welfare, all our policies, our procedures, all our legislation. We can't think that we're imperfect professionals in perfect systems and that we just need to get humans to do what they're told, right? We just need caseworkers that 100% of the time follow policy. That's just, not only is it not realistic, but it's not even safe. It makes the assumption that our systems are perfectly designed and that we just need to comply. But there's no evidence that tells us that that's true, that actually we're imperfect people and imperfect systems, and professionals, your assets to be leveraged, solutions to be harnessed within your agencies. You're the reason why the system works, the reason why families are cared for and experience success and health and safety. It's not for all of our great and fascinating policies, though hopefully we have lots of good ones. But it's about our really needing to lean in and listen to you and to your work in the field, that you do always in the best interest of families, and acknowledging that you're human, that we all are, and we have to create systems that are designed to meet humans' needs, like the environments that humans need in order to thrive. So thinking about how every human has the capacity, and certainly does, experience bias, fallibility, that these things happen emergently in our systems and our agencies, that we can't have an expectation of perfect performance. We have to be willing to design our systems to match what humans need them to be. By asking you questions too, so it's taking a really intentional departure from this shame and blame, point fingers. If I can make an example out of that mistake, then I know that you won't make it again. We can't have those rigid approaches to blame whenever we see a decision that we don't like the outcome of. So it's not asking who did this and why did you do it, but instead asking what and how. So having an open curiosity to learn and to change, and a restorative approach to accountability in our workplaces, not a retributive fault-finding one. And importantly, it's about expecting different preconditions for work. So it can't be about we each as professionals coming into work every day and just needing to have the grit to survive. That's not resilience. Resilience is not something, I'm going to make the argument that resilience is not something that lives in us individually. It's something that lives in us collectively. And in our systems, we need to think about how we can institutionalize resilience in our agencies, and also how do we institutionalize resilience in our teams, because that's something, not all of us on the call today are senior leaders and policymakers and big change agents in our systems, not yet, right? And so what can we each do to expect different preconditions for our colleagues in the workplace? What do we each bring to work that has that impact? So maybe we can unpack it a little. I'm going to spend a little time, I'm going to go through just a few slides. I want to describe the why we need this culture in child welfare. And I'm not going to spend very long here because I doubt you need much convincing. You're people who are presently or about to engage in social work and in public child welfare agencies. So you're people who already know this, but I'm going to give just a little foundation for why child welfare needs a safety culture. Stress and burnout, prevalent, so prevalent in our field. It has been exacerbated by COVID. Certainly all of us have experienced a lot of personal and professional stress and burnout through COVID, but even before the pandemic and all the changes and anxieties that came with the pandemic, we were an industry that struggled with traumatic stress and burnout. And how do we keep our workforce together, retained, healthy, doing their work? Always a concern, and perhaps now more than ever. And fatigue, also so pressing in our work in child welfare. I don't know what it looks like in Wisconsin, but when I was working in the field in Tennessee's Department of Children's Services, there was a time where it wasn't at all uncommon that a professional, a caseworker, whenever I say professional, I also mean caseworker. I use the two words synonymously. That you might be up for 24 or 30 hours straight, as you might be transporting a child across the state, or you might have been on call and meeting several responses to families' homes, and then you go home and maybe you shut your eyes for an hour, maybe, before you need to get up and go to court the next day. So I think that that's not just a challenge in Tennessee, but that across the country we have a very fatigued workforce that works many, many hours at once at times and doesn't really have the ability to draw upon a team to gather some strength in those moments. This is an image that just maybe brings up the grave concern of that challenge. It's not just about feeling tired and not being such a personally difficult experience. It's also about decision making as we're tired, because what you see in this image is actually an fMRI of someone with a full night's sleep and someone who's gone a day without sleep. And what you see are the emotional portions of the brain, so that parts of the inner brain are lit up. And that explains why under fatigue, we're more likely to be emotional, we're more likely to snap, we're more likely to make quick judgments, to kind of be guided by those basic human biases, cognitive fixation, Thinking confirmation bias, thinking that we know what's going on when we haven't gathered all the information yet. We're more likely to do that when we're under those sleep deprived states. And also the rational portion of our brain is restricted. We have restricted access to the rational portion of our brain when those emotional centers are really lit up and we're without much sleep. These aren't people so people under this condition are just being humans. It's not that they're incapable. It's not that they've somehow done something wrong. They don't need to go do something different. This is just what all our minds look like when we haven't had some rest before we've dedicated time to decision making and to work. But not at all uncommon in our field that we might have somebody out there actually making a decision about whether a family stays together or is separated, or whether a family is safe or unsafe, present or impending dangers, like actually making those really important decisions by themselves, maybe calling a colleague, but actually by themselves in the field with their brain under this type of condition because it's been that long since they've had sleep. Certainly stress response, important here too. I'm sure many of you are familiar with Harvard Center for the Developing Child and all the incredible research that they've done around adverse childhood experiences and different levels of stress response. I think what I wanted to point out in referring to this evidence base is that before they ever studied children, they studied first responders and the presence and effects of toxic stress and tolerable and positive stress among first responders. And certainly the difference between tolerable and toxic stress is it is the presence of the stress, how prolonged and chronic it is, but it is especially the absence or presence of protective relationships. And so what does that mean for us in child welfare? It means that those threads, that connectedness that we experience in our workplace is so important. So important that we think of ways to operate as a team in child welfare. Historically, what have people told us that we do when we experience bias, fatigue, stress? What we have said is for professionals to take care of ourselves. Take better care of yourself. Take up yoga, drink less coffee, get a good night's sleep. It's not wrong. It's not wrong for us to have the self-care discussion. It is important. But it is limited. It has limited data. It's not really what we tell to families. Think about your work with families. Did you ever tell the young parent who has 5 children under the age of 5 that things will be better for him or for her if she can rest, get some sleep at night, if she can maybe take a long bath and ask somebody else to watch his or her children? No, those things actually sounds rude to say that to someone who's experienced so much stress and fatigue, to simply say, you need to take care of yourself. It puts the onus of the response actually on the person. We need to think of systems being more resilient and teams within systems and how we bake resilience into organizations, into counties, into teams, and not that we just ask people to take better care of themselves. I would like to frame adversity and distress as a collective experience with collective answers, that when one of us are distressed, we all are distressed. How can we each bend some around those challenges to make our work environments better for everyone, which has much better outcomes for not only for us as professionals, but also for children and families. So this slide just says basically what I just shared, that there is some evidence out there, particularly about mindfulness practice and how it can be good for professionals as part of a self-care strategy, but there just is pretty mixed to no results about how self-care really works to help professionals. There was a study done a very long time ago, but it's just always stuck with me, where a group of, I think they were students, I think they were college students, who were gathered in a room, and they were asked to remember either 3 numbers or 7 numbers. So 3 numbers, very easy. I could probably give 3 numbers to you right now. You'd remember it at the end of this presentation, or 7 numbers, which is the stress condition. It's doable, but it's hard. You're going to have to work at that a little harder. 7 digits is like a phone number, harder to remember that than 3 digits. And then they just had to walk down the hallway. So, right, it's not a very stressful study, but you always want to get it right. They had to walk down a hallway and tell a person at the end of the hall whether they remembered the numbers that they recalled. And there was a distraction that students didn't expect. They either chose a piece of fruit or they chose a piece of chocolate cake. So it was a snack. They needed to select a snack on their way down the hall to tell the person at the end of the hall the numbers that they recalled that they had been given. And by and vast majority, those asked to recall only 3 numbers chose fruit, and those asked to remember 7 numbers chose chocolate cake. And so it's just a really simple, story that we can keep in our mind, that in those moments where we're stressed, we're less likely to engage our self-care. We're less likely to do those things that we identify as best for us. Harder to have that discipline. And so again, self-care, while valuable, just isn't the answer to what confronts us in the public child welfare space, and to the really taxing and difficult challenges that caseworkers and supervisors experience every day, and then engage in very high-risk work in the midst of those challenges. So in other high-risk industries, I'm going to use aviation as an example. They practice those high-risk, high-consequence moments, those things they never want to go wrong. And so what you see in this image here is when cabin pressure drops on the plane, oxygen masks fall. And even though, fortunately, cabin pressure rarely drops on a plane, and you're rarely in need of that oxygen mask, you practice it quickly, just a couple of minutes. You practice what that would be like should it happen, so that you're not surprised, and you know to put the oxygen mask on yourself first, and then on the person beside you. And I've actually seen this used as a metaphor for child welfare, self-care, like for child welfare or social work professions, putting the mask on themselves first, take care of yourself so that you can take care of those around you. But I want to extend the metaphor and say that when the oxygen masks fall, it's because they know what that high risk, high consequence moment is on the plane. They've gotten this down to science. They know where those moments are, and they drop the solution right in front of your face. So you didn't have to collect data on a spreadsheet or go flag down the flight attendant. You didn't have to make a case for why this was a high risk, high consequence moment. The system knew. The system knew when that high risk, high stress moment was, and literally drops the solution right in front of your face. I'm convinced that we have these parallels in child welfare too. How do we engineer systems, like big state systems or smaller county systems, or even within teams and program areas? How do we intentionally take moments where we identify the high risk, high stress moment? Like when I was in child welfare, it was any moment that we truly believed a child was not going to stay in the environment where we responded to them at. So something was going to happen. We weren't sure exactly what, but that moment, when you think something's going to change here, I'm worried. Everything that follows, a really high risk, high consequence moment. Testifying in court, really high risk, high stress moment. You want to get it right. You need clear, mindful time to prepare. So how do we start to embed in teams, in counties, some of this fabric, that helps the solutions we need literally fall in front of our faces when we need it the most? How do we view resilience as a property of the system? How do we view distress, adversity as collective and not individual in its properties. So let's unpack that. Let's unpack it a little bit. So leaders in the safety culture strive to balance systems and individual accountability. They value open communication, transparency, continuous learning and improvement. They have a growth mindset, vulnerable, approachable leaders. Teams in the safety culture also have responsibilities. All of us give and receive from our agency's culture. It doesn't just live in one of us, right? It lives in all of us. So teams in the safety culture, they monitor themselves, their colleagues, their system for signs of stress. So it's not just what am I doing, but what are my colleagues doing? How are we each working equitably in the path that we have ahead of us? So they communicate honestly, and often they share work equitably, they promote accountability, and they anticipate and respond to unexpected events as a unit. So if the family needs extra support at 7 p.m. on a Friday night, nobody's going there alone. That's something that we can do together. Same as when we know we're going to have some type of safety plan for a family. We all give a little bit more so that none of us have to give too much. So let's talk about two really important, I think, concepts and strategies within a safety culture. It's about psychological safety and mindful organizing. So psychological safety asks, do I feel accepted, respected, a part of a team? Am I free to speak up in my workplace? Are others free to speak up to me and take an interpersonal risk? And then mindful organizing is this social process. It's about the collective ability to detect and respond to unexpected events. So how do we engage in like some structure to our teaming? How do we create these healthy rituals that help us have improved outcomes for ourselves as professionals in high risk work? And how does it help our outcomes for families? So let's talk about psychological safety first, what it is and what it isn't. So psychological safety is a shared belief that comes from shared experience. So different from trust, which is more about my confidence, more about my kind of intrapersonal dynamics. Psychological safety is something we need to agree on together. It's a shared belief that comes from shared experience. It's a place where mistakes are treated as opportunities to learn. It's not a time to blame or punish. So it's having this really restorative approach to learning that says, what happened? How can we learn from it? Is there any repair that we can engage? Any repair that we can do? It doesn't say what was the infraction, who broke which rule, and what's the proportionate punishment. It's not retributive in its properties. It's restorative. And where literally anyone can ask questions without looking stupid, ask for feedback without looking incompetent, be critical without appearing negative. So if a plan worries you or a plan doesn't sound like the right way to go, that you aren't being viewed as negative for being in disagreement with the direction that's being considered. And you can suggest improvements without appearing disruptive. It's not free from accountability. None of us want that. We all want shared accountability in our workspaces. And it's not always comfortable because sometimes these are inherently uncomfortable situations about families we've worked with where we just don't think that we're headed in the direction that supports and helps the family best. We're talking about mistakes and vulnerabilities, things we worry about. These aren't inherently comfortable conversations. They're necessary conversations, but they're not always comfortable. And so it's being willing to create as much comfort and support around those conversations as we can, but acknowledge that they're inherently uncomfortable and that that's okay, that that's a space we're going to sit in together. So maybe it's because I'm from the South that I feel obligated to give you a metaphor of something close to where I live. So I live in Knoxville, Tennessee, not too far from the Bristol Motor Speedway, and I don't watch any NASCAR. Maybe some of you do or know someone who does, but But what I want to share is that we can hear about psychological safety and we can think, oh, sure, this is really intuitive to social work. This is consistent with what I've learned. Yeah, we're just going to do that, right? We're just going to have these psychologically safe workspaces. We're all going to feel safe, accepted, respected, supported. It's easy, right? We just do it. But like NASCAR, it's maybe as easy as driving fast and turning left, right? Because at the end of the day, that's what NASCAR is. That's what it's driving fast and it's turning left, but it's never as easy as what it sounds. The psychological safety is a really simple concept, harder to apply than what you might think. And here's some reasons why. There are what ifs that get in the way. They come up every day in our work. They certainly still come up for me, even a person who gets to sit in this space of psychological safety and encourage and help support teams and agencies to do the same. We all still have the what ifs that we mentally work through. Think of a time, it might be a time in your current workplace or maybe a time in the past when you didn't feel psychologically safe. You probably had some questions in your mind, things like, what if I'm wrong? None of us like to be wrong. It's human to want to be right. What if I look incompetent? None of us want to look incompetent. We all want to bring our best. What if I'm seen as negative? What if I sound disruptive? We're social creatures at heart. It's the nature of who we are. And so it's hard to say something that feels like it might be against the grain of the group. What if they get angry? What if they don't like me? The what ifs that can get in the way of even our best intentions when it comes to psychological safety. It is a path, right? We don't get there in a day, and all of us start in different places on our journey. I think at first it's challenger safety. It's coming into our workplaces, feeling that like we have an obligation to practice psychological safety. We also receive psychological safety, so that it's both. We start often in a place of just candor. We're willing to challenge ideas and norms. We're willing to speak up with concerns. That's level one. We come into our workplaces and we're willing to challenge some ideas. After that's collaborator safety. It's engaging respectfully, equal voice, constructive debate. So now I'm just not going to tell you what I think, but I'm also going to dialogue with you about it. I feel safe to dialogue. Healthy conflict, I don't take it personally. After collaborator safety is learner safety. So I come to my workplace, not only am I candid and willing to speak up with my concerns and also willing to debate, like to engage in them, but also I'm willing to ask questions and grow. So I'm in a space now where I don't have to be right. I can change. I can grow. So these conversations aren't just about changing those around me. Now I also am changing as a result of my experience. And inclusion safety is about membership, feeling valued, that no single one of us sticks out. We're inclusive and treated equitably, fairly in our environment. So I want to recommend to you a book. I know the slide's a lot to look at. I want to recommend to you an amazing book by an amazing author, The Fearless Organization by Amy Edmondson. I feel like she and Brene Brown are on the same wavelength. Brene Brown and Amy Edmondson probably attract maybe similar but different audiences. I think Amy is thinking a lot about the system level, but she still has some really practical advice for just day-to-day interactions. It's not just for agency leaders, but thinking about how everyone contributes to psychological safety in the workplace. She did a really incredible TED Talk. She has a couple really incredible books. The Fearless Organization is her most recent book and is still one that I turn to or find myself reading again just to remind myself of my own journey and my teammates' journey and what we're working on. I saw this on LinkedIn, and I saw it recently and threw it in here, just thinking this really maybe gives you an image to something that's really important, that in our workspaces, because we do such high risk work, because the decisions we make are so important, we need to create these spaces where we have both challenge directly and care personally. And I heard that referred to as compassionate candor, and I really liked it. So I wanted to share that with you. So let me give you just a few kind of quick tips that I hope are helpful. So what do we each do to foster psychological safety in our workplaces? I think we do it by being predictable. So when you say you're going to do it, do it. When you're overwhelmed and worry you're not going to get to it, be clear. Be clear, be honest, be kind. We can be both candid and respectful in our engagements with our supervisors and with our colleagues. Be vulnerable. It's especially true if you're a leader. If you want psychological safety to be something embraced in your organization, if you want people surfacing mistakes and problems, challenges, divergent points of view, which we need the willingness to do that in our space serving families. If you want to see that, you've got to start with yourself. There's nothing more powerful than you being a leader who's willing to vulnerably share your own mistakes or times when things didn't go the way that you intended. Those moments of vulnerability display our humanity, and they model for others what we're asking them to do. It really has to start with us. We have to be willing to show as leaders mistakes that we've made. When I used to teach a course on this at the Child Protective Services Academy for Tennessee and their Department of Children's Services, I would always open the training by describing a mistake. I've made many mistakes in public child welfare work, but there's one that rises to the surface for me. It's the one that I carry with me the most, because I'm absolutely positive it was the moment that led to a course of events that resulted in a child being harmed. And we have to be willing to talk about the hard moments. That's part of how we learn as professionals. It's also part of how we build better systems, is by explaining how things fell through the cracks for us. So we don't just learn by virtue of having an experience, we learn by processing our experience and getting the support from our colleagues. And our systems learn from our stories. Our agency leaders and policymakers, they learn from our willingness to give them that candid account. It's so important that we create these spaces in our work. It's about being connected. I say that because I think I'm a very task-oriented personality. So if you're listening to this webinar, probably multitasking and doing some emails or other things, I see you, I am you, then you might find being connected kind of a challenge, because I'm a person who can just kind of stay insular and to herself and just hammering stuff out. But we're so much more, we bring so much more value to our workplace, and we make such better decisions for ourselves and for families, and we're really willing to stay connected, like in this cadence, this rhythm of casework practice that's not just about me and my cases, but is also organized around how I share and communicate what I'm doing, helping others and getting help from others. So important that we find spaces to be connected. I've perhaps never been more aware of this than through the pandemic, where so much more of our work has become remote. And I recognize the value in even just simple things like coffee breaks together, even if they're on Zoom, but so much better if they're in person. Just the chance to connect and be a human among other humans. Lunches, getting to see my teammates in person, it just makes a big difference. So thinking of what does connectedness look like in our team or in our agency now, and what could connectedness look like? What makes me feel connected? What makes others feel connected? What's like that one thing that we could do? I saw in the partnership, we have a group called the Innovation and Implementation Learning Community, and they're spending a year dedicating their time to think of how do we increase workplace connectedness in our workspaces. And someone showed a picture of like all these puzzles and fun like fidget toys, like just ways that they were trying to bring people together in the office as they came back to a pretty full in-person in-office response after the pandemic, and just how useful that would have been. A big coloring page on the wall that everyone was contributing to. Just really cool ideas, I think, of what that can look like for each of us. Asking things like, what am I, us, others concerned about? So ritualize that in your conversations with your team. What am I? What are others? What are we worried about? What do we feel good about? What are we learning? And what are we worried about? Have an appreciation mindset. Just in the call I was in before this one, someone said to me, it was actually the Innovation Implementation Learning Community. It was Asia Davis, who is in that group. And she said, I believe in giving out flowers while people are still alive. And that just resonated with me, and that just connected with me, that we each need to be that way. You just said it in such a powerful way, that we need to think about that for our colleagues as we come into the workplace. Give grace, be restorative. It's so easy, and I do it too. It's so easy to hear a conversation about safety culture and psychological safety, and to take away from that conversation and think, dude, I can't wait until so-and-so, right? I'm going to put air quotes out there, until so-and-so gives that or makes that precedent or does that thing. And that's true. I mean, I'm sure that's right. But also we have to give grace for people on this journey, be restorative in our approach. So all of us matter in workplace culture. What can each of us give? So don't just think about what others can do. Ask yourself what you can do and how you can challenge yourself. We each probably have so much more control, influence, I should say influence, than perhaps we think. Supervisors, I've got some simple tips maybe directly for you as child welfare supervisors. So check in and stay curious. Do conversations change as soon as meetings are over? The answer is yes. You might have a psychological safety challenge, a psychological safety problem. Don't lean away from it, lean into it. It's something to think about, and ask yourself how you might be able to help that group make a pivot. Frame distress as belonging to the collective, right? So adversity is something we each share and we're each going to build around. And when one of us is struggling, or two or three or many of us are struggling, we're going to struggle well together. Start framing adversity and distress that way, and moving away from seeing distress and adversity as something where we need to tell people to take better care of themselves. Be savvy about what keeps humans healthy. So think about opportunities to connect and expend energy. Don't gossip or speak negatively of colleagues' character or intentions. Sometimes that can be easy to do, right? You may not even be realizing that you do it, but when bad things happen, it is within our human nature to want to look at a person and blame them for it. It's fundamental attribution error. It says, you know, when you do that thing or that bad thing happens to you, I think it's about your character, some flaw in your judgment. But when the same thing happens to me, I am more restorative and appreciative of context. We have a competitive human nature, perhaps especially in Western societies. We have a competitive nature of wanting to seem that we're on top of things. I read a CBS News article once that says 7 out of 10 of us think we're above average. That statistic doesn't add up, right? But we have a competitive nature. And so be conscious in your decision-making and your behaviors to realize what that looks like and how it might show up in your work life. Ask things like HBR, Harvard Business Review, just published this really interesting article. I'll send it to Ellen so that it can get to each of you, called about relational pauses. So taking a moment to say, how is our work affecting us as human beings? The HBR article was describing that disconnectedness, so feeling unconnected, unpsychologically safe in our workplaces, is just as much of a public health issue as smoking or drinking too much alcohol. So just like those two things really contribute negatively to our health, research is showing us that these disconnected, unpsychologically safe environments contribute equally to our health. So just taking a moment with your team, how is our work affecting us as human beings? Giving us a moment to ground around that has evidence of really improving our experience of psychological safety, our experience of connectedness in our work environment. Ask, especially as supervisors in meetings where decisions are being made, can someone give us a different point of view? So create that space where the different point of view is what you're asking for, rather than just saying, does everyone agree? Say, tell me a different point of view. Give me a different way to look at this. You're engaging in that, you're giving that open space for some divergent forms of thought, which is so important in the work that you do with families, to think about what you might be missing, or what you might not be considering, or what maybe you're worried to bring to the surface and try to help the family wrestle with, or resource support them differently. In supervision, you might use simple strategies like plus, minus, interesting. So in other words, as you're closing out work with a family, say, what went well? What didn't go well? What did you find interesting or new? What surprised you? Taking a restorative approach to learning, creating space for listening and support. We get far more done in those environments than we do when we rigidly or punitively hold people accountable for mistakes or deviations from practice or policy. We get a lot more out of a restorative approach to learning than a retributive one. So here's what some really early data tells us. It tells us that with psychological safety, as it increases, so does workplace connectedness, and turnover decreases. Also, as psychological safety increases, we find that mindful organizing, which is really, I'm going to talk about that in a minute, it's that collective capacity to anticipate and to respond and to learn from events, so organized teamwork around high-risk decision-making. That's mindful organizing. That as psychological safety increases, so does mindful organizing, and emotional exhaustion decreases. And as mindful organizing increases, workplace connectedness increases further, and emotional exhaustion also decreases. This is also where you start to see some difference in child-level outcomes. So as mindful organizing increases, parent-child visits increase, placement disruptions decrease. For youth served in congregate care settings, as mindful organizing decreases, youth experience fewer care interruptions. A care interruption would be identified as like a psychiatric hospitalization, or a night on runaway, or a night in detention, that those decrease as mindful organizing among that residential care team increases. So let's take a minute on mindful organizing. So psychological safety is there to build and increase upon the practice of mindful organizing, the social process. It's about engaging in both hope and doubt simultaneously. So it's this pro-social, team-based behavior that says we're always going to hope for the best outcomes. We're inherently optimistic. But then we also experience doubt. What are we missing? What might we not be seeing? What might not be surfacing in our work with families? And how can we talk about that and get there so that we can do our best possible work for the families that we serve? It's been long studied in wildland firefighting, where teams from all around the country have to come together. They've not known each other for more than a few minutes, and yet they have to get organized around how they structure their teaming to harness, to stop forest fires. A lot of research done through Project Aristotle. This is really some of the first research about psychological safety in the workplace. It was the #1 predictor of innovation at Google. They searched many other things looking for that innovative sweet spot, like what helps a team be particularly resourceful and effective. At Google, they looked at personality types, degrees, different types of team compositions. The #1 predictor actually for innovation was about psychological safety. And also in healthcare, nursing teams, as mindful organizing and psychological safety increase on teams, you also see fewer patient falls, fewer patient readmissions, fewer medication errors. Oh, I showed you that slide twice, I didn't mean to. Oh, I forgot I put these slides in here with outcomes. So these are the outcomes I just mentioned before. So it really distills down to 6 habits. And we have what's called a Team First Field Guide. That's a curation of strategies from actually team steps and crew resource management that we use broadly with child welfare teams to think about how they might try out some new rituals in their teaming practice to enhance psychological safety and enhance mindful organizing. So it really distills down to 6 habits. You'll get the field guide at the end of the webinar today. Spending time identifying what could go wrong, talking about mistakes and ways to learn from them, testing change, developing an understanding of who knows what and communicating, appreciating colleagues, and making candor and respect a precondition for our teamwork, because we can in fact be both. We can be both candid in our engagements and respectful. So just a few things that you might take away from here and try with your teams. Maybe try using prep huddles. You can do these virtually or in person. They are short. They just last 10 or 15 minutes. I've seen child welfare teams do them before they go into important meetings or as a child is moving, a youth is moving from one placement to another, or a youth has just come into care. I've seen huddles used to kind of rally the team around. Here's what's happened, here's what we need, what are we each concerned about, what are we each going to do? So how do we share accountability for the things that happen next? It becomes this well-orchestrated handover time where we talk about what's happened, what's working, what are we worried about, what are we each going to do? I've seen huddles used in that context. 10 or 15 minutes, this is not a meeting. The idea is to be structured and efficient, to do huddles often rather than thinking of them as a long formal meeting where you may be doing them less regularly. Also, the beginning and end of the week is a really good time to do a huddle. So what do we intend to do? What are our plans? What are we worried about? What are you worried you won't get to doing, or what are you worried you won't do well, you don't have the expertise yet to do well? Say it out loud to your colleagues. Give a chance for everyone to give feedback and to organize teamwork based on the abilities and the expertise in the group. Good way to begin and end the week. Also debrief. So when things don't go as intended, failure is not a bad word. We're able to say that failed, that didn't go the way that we wanted it to go. Let's take time, let's circle up what went well, what could have been better, and what will we do differently next time. Again, just 15 or 20 minutes. I've seen child welfare teams do debriefs whenever a youth was bench ordered into custody and it wasn't what the child welfare agency had petitioned or had wanted, so it wasn't what they had desired. Also, just anytime a family has been in the care of or in the services, the engagement of the child welfare agency, and then that case is closed or that assessment has closed, and then another one opens. That's a moment to do a debrief. What happened? You know, what have we done? What could we have done better? What might we not be seeing or maybe have not served this family in the way that they most need from us? How can we innovate? Think about that for the next time. And good for debriefs to start with a cue, just like what I described. And then one last strategy, and then I want to go to questions. I'm excited for what questions you might have. Structured communication. I know when I started my work in child welfare, one of the things I found most challenging was just how do I concisely organize all the information that I have about a family. Like, so if I was working with a family and now somebody else is going to begin working with a family, how do I communicate where we're at, what we've been doing so far? What are kind of those structured communication strategies that I might use if I'm going to go talk about my collaborative work with a family in court, or if I'm going to do it to some type of a child protective investigative team? What can be like the structure for that conversation? Because sometimes things can feel very unstructured, and then we start passing a lot of information through supervisors, right? So caseworkers are talking to supervisors, but then supervisors are really carrying all of that information to someone else when they've perhaps not been the one who's been working with the family. And information can get lost in this kind of messy game of telephone. And so how do we support each other with some structured communication that we all can get used to? It's not there to box us in, it's just there to give structure to a conversation. They've been using those strategies in healthcare for a long time, but a really simple one is Sbar. So situation, what's currently happening, background, what historical background is there that's relevant for me to share with you, assessment, what risks do you see, what risks do others see? So what do I see as the person who did the assessment? What also am I hearing from others, even if that's divergent with my opinion or with the formulation that I made? And then recommendation. So what do I recommend next? What decision would I like to empower or put forward for the group? Very simple. I knew a team, actually an entire county once, who just put Sbar on the back of their county badges because it was just a way they wanted to get accustomed to communicating about the work that they were doing with families. I knew another team who started using Sbar actually in written form as the cover sheet to their court reports, because their court reports to the judge tended to be very long. There was concern the judge wasn't reading the reports. So they're just asking themselves, how can we be more efficient? Like we can't, well, perhaps we could, but it would have taken some agency level, cross-agency level work to actually change the form that went in front of the judge. But instead, what can we just kind of add to the top that says quickly what we're experiencing, what's happened in the past, what our assessment is, and what we would like to see moving forward? That just saying that really concisely might really help in communications with the judge. And they found that it definitely did. I also have seen agencies that automatically deploy another case manager whenever there's an infant in the home and the children are potentially not going to be staying with the family where they were located. So immediately get somebody else's hands on deck in the field right there with them, thinking about those next steps, because it's just so important to child safety and family togetherness. So it's a quick huddle and then actually somebody else deploying out in the field to support them. All right, I feel like I threw a lot out there at you. How about some questions?
So we have one question here that
sharing my screen
is a great question. What suggestions do you have for encouraging the agencies we work in, especially if we're not in a position of leadership, to move away from the idea that self-care is your responsibility to the idea that self-care is a group responsibility or a system issue?
That's a great question. I'm going to share that HBR article with you for you to share out, because I think that can be a good, that's a strong, reputable source, cite some evidence that I think is important for agency leaders to see. Leaders need to hear from other leaders. I think that's the magic of the national partnership, is the level of community that exists, that you as a leader can kind of call out or call in what you see from other leaders, and think about how it's helpful to change a strategy or change a course. I don't know that I have specific advice, but maybe that's helpful. I hope it is.
Thanks for that. I think it's a really interesting question too, because as social work professionals, we spend so much time thinking about person and environment, and so much time thinking about micro and macro, right? And so I think about like the idea around self-care is that we've primarily been tackling that as a micro issue on an individual level. But like you're talking about today, it really is a system problem, and truly is a macro issue. And I often have wondered if framing it in that way is helpful to leaders also, that their job is to think systemically, not just individually.
And even framing self-care, so the word self-care implies the individual, but I've heard of teams, agencies, literature that use the phrase "we care." It's still the same self-care strategies, but it's thinking about how do we institutionalize it into the team's work or into the active supervision. So, walking as a team, or walking in supervision, different or better than staying in your cubicles. Mindfulness practices that you can engage in the workspace as a team. I think that those are all us moving in the right direction, though there's so much to do, so much space for innovation.
That's great. And so I have another question, and I also think I'm going to be able to post the article in the chat in just a second too. So I'll do that too. So the next question is Wisconsin involved in your organization, NPCS? What are the benefits to those involved? What's the commitment level, and how do we get information about the group?
Oh, yeah, sure. Gosh, there are a couple of things. So I can pass the press release and also the tools and resources used across the partnership. I can give all of that to you, Ellen, for you to pass back to attendees.
Great, thanks.
In the national partnership, I was going to say, DCS, so the state entity, has been the entity to join the partnership. All of those resources certainly have impact and availability to all the local offices too, but having first a systems-focused, supportive approach to learning and system level improvement from a child death or near death that had open or recent agency contact. That's the first and foremost act across all partnership sites, is that they work towards and sustain that way of supportively learning and growing their systems without isolating or fault finding with an individual when they've experienced a really sad outcome for a family that they've served. And so you do that in Wisconsin through your system change reviews. I know that team really well. But then also there are many resources, and I'm glad to share them with Ellen.
Great. And I think we have a list of attendees, and so we should be able to share that information back out. Okay, we have another question here. One of our participants is wondering if we would be able to get more information regarding some of the results and or ideas your implementation and innovation committee came up with to keep your agency connected. Do you have examples of those?
Oh, sure. They just started. So the cohort last year was about racial justice and the safety culture. And the cohort this year is about building workplace connectedness in our agencies, in a safety culture in our agencies. And they just met for the second time today. So they're doing lots of small tests of change, small strategies. They're really early in their work, but we intend at the end of this year to actually have a some practice guidance, some ways that we curate everything that was done and how it worked out, and to offer a webinar broadly, nationally. We'll make sure that that has good open availability and that it's recorded, to talk about what they did and what their results were. I don't have much to report now. I'm sorry about that. If you send me an email, I'll put my email in the chat. I'm glad to tell you what's been tested and done so far, but I don't have anything organized to share with you.
All right, here's another one. How do we navigate conversations about how our work impacts us personally, productively, and without dwelling on anything negative?
To me again, or maybe I can pull it up and I can read it to you.
Yeah. So the question is, how do we navigate conversations about the impact of our work, without just dwelling on the negative?
That's a good question. There's definitely conversation out there, and rightly so, that talks about, I have a good colleague, Jenny Sprang at the University of Kentucky, who does work in the National Child Traumatic Stress Network. And she talks about what she refers to as sliming, where we, in the context of talking about our work, expose people to the traumatic images and traumatic experiences that we've had by regaling people with every detail, and how we need to put some structure and some boundaries about how we share that in our workplace. Trying to think of the best. Feel like we could have a really good discussion about that without dwelling on the negative. But the reality is our work impacts us in positive ways, things that give us joy, fill us up, the reasons why we chose this work in child welfare. I think it's important that we take moments to connect to the positive, but we've got to give some space, even if it's just a few minutes, to describe. This isn't, when you have that relational pause, and it's described in the HBR article, when you have a relational pause with a team and you say, how is this work affecting us as humans? The point is not to drag on and on about the negatives, but to take a moment and to connect to, how am I personally affected? How are you personally affected? It doesn't have to be about complaining per se. It's just like this willingness to say aloud that we sit in a space of discomfort and hardship in what we do. I don't know that that's negative per se.
Thanks. Yeah, that's such a hard one, right? There's so many clinical implications around how we talk about the impact and, dwelling versus processing, and so much of it's very individual, and yeah. So I don't know if you know the answer to this. This is a question that we're all really curious about, but I'd love to hear your experiences. This is a new question in the chat. Can you comment or give some suggestions on how to promote connectedness for teams in a remote work environment?
Oh my goodness, this is, I wish you were talking to someone from Vermont right now, because I know Vermont, and also Franklin County, which is Columbus in Ohio. They were talking about this, they both were talking about this so much in the innovation, implementation, and learning community, which I was just on before I joined this. I don't know about the evidence base yet. I can tell you things that I see teams trying, and to see if any of this fits or sparks an idea. I see teams taking the first 10 minutes of their standard meetings. So think of what meetings you might have during the week. They take the first 5 or 10 minutes actually not to talk about work, but instead to just talk about life. So just to talk about things going on with your kids or things going on with school, something fun that you did the week before. It's what they're trying to do is they're trying to supplant what used to happen in our office spaces when people would just come by and just talk to you about this thing that happened that, you know, like my daughter last Friday was pretending to be a kitty. She spends at least 70% of her life pretending to be a kitty, but somehow she cracked her chin on the floor. She had to get 5 stitches. That would have been, she's just fine now, but it was a hard moment. That would have been exactly the thing that I went into my workplace and told to my colleagues. Like, I can't believe this happened. All the wild, like, monkey climbing that she does all over our house, and it was crawling on the floor that actually got her 5 stitches. But we just don't have those environments. At least I don't have those environments anymore in my workplace. And so we have to think of how we create those moments. In my team, a few times we've actually gotten on a Zoom, not to chat, but just to work while also on a Zoom, so that if you say something out loud, you're saying it to people as if they were in an office with you. And we found that we feel a little silly when we do it, but it's kind of nice. It's been a good way for us to team up and communicate on some work that we do together, but not feel super structured about it. What do you think, Ellen? Do you have any?
This is the question, isn't it? I mean, people,
Yeah.
And it seems like there are disparate needs. So teams that were really connected and have a lot of tenure seem to be managing this remote environment better than teams with new people. So this is a question that's been coming up a lot lately, especially around new worker training, bringing new people into systems and making them feel connected, because you don't have the more senior people nurturing and help, answering questions. So we've been talking about this a lot in terms of retention and support, and exactly what you said, right? Coming on a little bit early, doing some time like that. I know some other folks, when they've been bringing new staff on, they have open office hours. So it's kind of like you open a Zoom room and people can just either drop in to meet the new person, or they can just kind of come in and out. And that has gotten some energy going, especially if you as a leader, you pre-fill people, like you call up people and say, hey, could you really come in at 10 o'clock and talk to the new person? So that's another idea that people have been doing to increase team building.
Yeah, we started that in the partnership. We started drop-in hours. And so interesting, people drop in, actually not because they have a question, they just drop in to hear from the group. And it's been the most interesting and rewarding conversation. Sometimes it's about the partnership and the partnership's work. Sometimes it's not. And then sometimes it's about actually an outcome that we're working. Like, there's a lot of conversation about safe sleep, safe infant sleep across the partnership, because they have the really overt aim of reducing maltreatment related fatalities and all child fatalities that comes to the attention of the child welfare system. And so it was a really interesting, candid conversation just about our experiences as parents with infant and toddler sleep. And you just wouldn't have those conversations if not for the ability to just have kind of like this drop-in environment where people can just kind of join and talk informally.
So speaking of that, I have another comment here, which, we're so appreciative to have you here today, but we also know collectively that the 134 people that are participating have a lot of expertise as well. And this modality doesn't lend itself super well to a lot of conversation, but I'm going to read what Megan shared. So she's just said, this is a comment. Prior to leaving her direct practice position, the agency she worked for started implementing strategies borrowed from the sanctuary model to help mitigate the impacts of trauma across the agency at both the staff level and the client level. I found this to be a refreshing shift and felt it was helping us move away from being blaming and more empathetic. It requires buy-in, which can be tricky. And it was so important for leaders to be on board since it was an organizational shift. So thank you for that. And I don't know if you have any response.
Thank you for sharing that. I've heard good things. And I actually, I just bought a book about the sanctuary model. So I love that Megan brought it up. That reminds me to move that book to the top of my read list.
Yeah, it'd be interesting to have another conversation with you about the integration with the model that you use as well.
And I wouldn't say that we use a specific model. We're drawing broadly from strategies across industries. But actually, we're importantly trying to not create a model because there are just so many different ways that this work shows up. We're not in a space of needing to push any of them out. They're all equally valid.
Well, thanks for that. Yeah. So those are all the questions that we have here today. So I think we can go ahead and close out. I just want to say thank you so much, Dr. Lindsey, for spending this time with us today and starting this conversation. I hope this is just the first of many conversations that we have around supporting our workforce and supporting each other. And so thank you, all of you who took the time out to spend with our group today. And we will follow up with that additional information to the folks that were on today. So thanks again, everyone. Have a wonderful weekend. I hope that spring is really around the corner here.
Take care. Thank you for having me.